Hey everyone, this is Dr. Charlie Johnson, physical therapist, and in this video I'm going to share with you 6 telltale signs that your buttock pain is not caused by Piriformis syndrome. So many people believe that they have Piriformis syndrome, but it's actually quite rare. So roughly 3 out of 100 people have a pain in the butt will have it due to Piriformis syndrome. The other 97 of those 100 people will have it due to a back problem or something else. So Piriformis syndrome in and of itself is very rare. Here are some quick and dirty tests, if you will, and kind of things to listen to or for in your story so that you can pick up on them and very quickly rule out Piriformis syndrome as the cause of your pain in the butt. And by the way, if you want to figure out the most likely source of your back, butt, or sciatica problem from the comfort of your own home for free without x-rays, MRIs, or other tests, be sure to download my Better Than an MRI DIY diagnostic guide above. All right, so the first telltale sign that you do not have Piriformis syndrome is if you have a pain in the butt, you also have a pain in the back, meaning if you have back pain and buttock pain at the same time, it's probably not a coincidence. The back is probably the cause of the buttock pain. Now, one thing to understand is that when we talk about referred pain, or pain sent from a structure in the buttock or the back, generally referred pain goes downstream. So, for example, if the piriformis is a problem, you will feel pain in the buttock and you may feel pain down the leg, but you will not feel pain in the back. All right? Piriformis doesn't send pain upstream. Now, if you have a back problem, an upstream problem, that can refer pain downstream and cause not only back pain, but also buttock pain. So if you have those two pains, back and butt pain, chances are much higher that you have a back problem causing both symptoms or sensations, and the chance goes way down that you have Piriformis syndrome, all right? The second telltale sign that you do not have Piriformis syndrome is also related to the location of where you feel pain, and it's if you have pain in both buttocks. So the chance of you having Piriformis syndrome is like 3 to 6%, pretty rare, in one buttock, let alone then having it also in the other buttock on both sides. Again, what's more likely happening is that you have a problem upstream causing you to feel pain into both butt cheeks. All right, so both-sided symptoms essentially rules out Piriformis syndrome as the cause of your buttock pain. The third telltale sign, again, also related to the location of symptoms, is that if you have pain not only in the butt, but also in the groin, all right? So if you have groin pain and buttock pain, well, we know that the piriformis does not refer pain to the front of the hip. It might refer pain, obviously in the butt and down the leg, but it doesn't send signals to the front of the hip into the groin. But there is something else, another pathology or issue within the body that can cause not only groin pain, but also pain on the outside of your hip and also buttock pain all at the same time, all right? Piriformis syndrome will not do that. So if you have groin pain, and you have buttock pain, chances are much more likely that you have a problem within the hip joint. We call this an intra-articular. Intra, within, articular, the joint, the hip joint, which is causing groin pain. You might feel like it's a tight hip flexor or a psoas problem. It's probably not. And it's also causing referred pain to the buttock. All right, so if you have buttock, outer hip, and groin pain, probably a hip joint problem, not a Piriformis syndrome issue because the piriformis doesn't send pain to the front of the hip. All right, so the fourth telltale sign that Piriformis syndrome is not the cause of your buttock pain is if you can move your back in one of the directions I'm going to show you here in a second, and it causes you to feel a pain in the butt. All right, so if you have a switch up here, and when you wiggle it, it causes you to feel a jolt here, this is the problem, an upstream problem causing a downstream effect, in this case, something in the back. The joints, the discs, ligaments, the other structures in the back can cause buttock pain, and so now we're going to stress them out, move them a little bit, and see if it causes your issue. So let's just say, in this case, she has pain in the left buttock. Obviously, you might have pain in the left buttock, or you might have it in the right. It doesn't matter. Just take this and apply it to your situation. She has left buttock pain. She may or may not have back pain. If you're watching this, you may have buttock pain caused by a back problem, but maybe you say, I don't have any back pain, which leads you to believe you have Piriformis syndrome. But as we go throughout this test, you might find that moving your back causes the problem. So back pain or not, this is irrelevant. Just go through the test. We're going to move in 3 different directions. Get a baseline of what you feel. First one, feet shoulder width apart, bend straight backwards. We're closing down on the joints, the nerves, the discs in the spine, all things like that. What do you have? Any problems? No. No problems. Does not cause her buttock pain. Now, what I want her to do is twist towards the pain-free side, her right side, and bend straight backwards. We call this a rotation extension test. Closes down on the joints more so on that side. Pain or problems? Nothing. Now what I want her to do is twist, rotate, towards her painful side and bend straight backwards. Yucky. All right, causes her pain in the buttock, and you can see she's a little bit stiff or restricted there. So something about her closing down on the joints, on the nerves, on the disc, on that side of the spine, and doing this motion causes her to feel pain in the buttock. She moved her back, she didn't move her buttock, and she felt the pain via that motion in her butt. That is a sign that she has an upstream problem, a back problem, which is causing her buttock pain. You don't have a buttock problem, you have a back problem. The fifth telltale sign that you do not have piriformis syndrome is if you contract it or if you stretch it and it does not cause pain or problems in your buttock. So if you have a problem with a muscle, when you pull on it and or when you try to use it, it should cause pain. All right, and so what I want you to do is 2 simple self-movement tests. Is we're going to try to lengthen it or stretch it first via the figure 4 stretch. This might look familiar to you, all right? And do you have any pain or problems doing that?
No.
All right, so she has no pain in the butt when she lengthens the tissue. Well, again, if a muscle's a problem and you pull on it, it should irritate it, but it's not. So now after we did the stretch test, all right, via that figure 4 by pulling the knee to the opposite shoulder, you're going to do a contractile test. You're going to try to use the muscle. And so a simple clamshell motion works generally pretty fine. And she's going to feel the muscles working. She's working her deep rotator muscles, which is the piriformis in this case, as well as some others. But if I push down on it, and even if you just hold it, do you have any pain or problems?
No.
It might feel weak, but we're not going for weakness here. We're going for a reproduction of buttock pain. If this test is painful, either pulling on it or contracting it, you may have piriformis syndrome, but just recognize that you're pulling on many different things, all right? So just because you have pain while doing this doesn't mean that you do have piriformis syndrome. If you don't have pain while doing these 2 tests, then you do not have piriformis syndrome. All right, so the 6th and final sign or test that you can do to determine if piriformis syndrome is the cause of your pain in the butt and or the leg is to check downstream, to check if you have any type of weakness. So neurological weakness, meaning weakness due to a nerve being compressed or affected at the level of the spine, is pretty much never associated with piriformis syndrome. So if you have weakness via the 2 tests I'm about to show you, it is much more likely that you have a problem at the level of the spine itself, not outside of the spine, like in the buttock, affecting the L5 or S1 nerve roots in this case. Disc, joint, something like that, a spine problem, all right? So 2 simple tests. Again, if you have weakness, you do not have piriformis syndrome. If you do have weakness, much more a sign of something in the spine. So the first test, we're going to assess the strength of the shin and kind of the toe muscles, all right? And one simple thing you can do is just heel walk. So you can either walk in place or like this, right? And if you can do this and you have strength to pull up your toes, then you do not have weakness of the L5 nerve, meaning the L5 nerve is fully functioning and you probably do not have a spinal problem. And you may have piriformis syndrome, but you don't have an L5 nerve issue. Let's just say that you go to walk on your heels and one foot pulls up. Remember, her symptoms were on her left side and this side does not. Or maybe you notice as you're walking, your foot is dropping or dragging. That, again, is most consistent with a spine problem, not a piriformis problem, and it would indicate an issue with the L5 nerve, which is a very commonly affected nerve in the spine. All right, so that's L5. And now, the S1 nerve, all right? So the S1 nerve, the next most common problem in the spine affects the first sacral nerve, S1 nerve, and that supplies the strength to your calf, the backside of your lower leg. And so what you can do is you can do heel raises, all right? So that's the next test. So what I would have you do is I would have you on your good side, on your unaffected side, go ahead and do some heel raises, and let's just get a sense for how strong it is, what it feels like, and the ability for you to do that. So I just do, 3, 5, something like that. You'll get a sense for how it feels. And now what you would do is on the affected, painful side, you would go ahead and you would try to do a heel raise as well. Right? Now, notice she can't do it, all right? And the reason I had her sort of act this out like this, right, is because it should be very clear. If you have a spinal nerve root problem, if you just feel a little bit of weakness, well, there's lots of things we feel, but maybe they're just perceived and not actual. So it should be pretty clear, right? So if you did a bunch of calf raises on the right side, you got an idea of how it works, and then you can barely get your heel up, or you get it off a little bit and then it just drops, then that points to an issue with the S1 nerve. Again, it points to a spinal problem affecting the S1 nerve root, not a piriformis problem. All right, so there you have it, 6 telltale signs which indicate that you do not have piriformis syndrome as the cause of your buttock pain. Maybe you thought you did, but maybe now you find that you don't. It's some other issue. Either way, we would love the chance to help you solve this. So we work with people all around the world dealing with back, butt, or sciatica problems. This is my exclusive specialty. And the goal is to teach people how to use the power of their mind and movement as medicine to heal naturally. We want to teach you what you need to do so you're not relying upon someone else outside of you or a random sheet of exercises hoping that it eventually works. If you're interested in getting some help for this, go ahead, click the link below to apply to work with us. It'll take you to a screen where you set up a time to chat and then follow instructions to submit a detailed case review. I review all cases personally. If we feel we can help, then obviously we're gonna let you know and we can talk about what that plan looks like. Also, let me know in the comments below, do you have piriformis syndrome or were you able to rule it out? Thanks.